How to treat shock. First, let's define what is shock. Shock is a critical condition brought on by the sudden drop in blood flow through the body. The causes of these shocks are severe bleeding, heart problem, losing body fluid, severe allergic reaction or infections, and lastly, spinal injury. How to treat a person experiencing shock? First, lay them down. Second, raise their legs. Third, call ambulance. Fourth, loosen tight clothing. Fifth, keep warm and calm. And lastly, monitor their level or response. These are the process of first aiding a person encountering shock. How to treat a person in drowning. There are two scenarios in drowning. The first scenario, the casualty conscious. These are the things to do. Place the casualty in a comfortable position. Cover the casualty and give them some dry clothes. Lastly, call the emergency services or the ambulance. And the second scenario, the casualty and unconscious and unresponsive. These are the things to do. Lay the casualty on their back, tilt up their head and analyze their breathing, call emergency service or the ambulance, and lastly, act accordingly to casualty states. How to treat wound. First, let's define what is wound. Wound is an injury to living tissue caused by a cut, blow, or other impact, typically one in which the skin is cut or broken. In first aiding a wound, these are the things to do. First, wear a glove if you have with you. Second, apply some pressure to the wound using a piece of gauze. Third, raise the injury. Fourth, clean the wound. 5. Gently dry it. And lastly, apply sterile dressing. How to treat fracture. First, let's define what is fracture. Fracture is a break, usually in a bone. These are the things you must do. First, know the situation of the victim. Second, check if the casualty has the sign for fracture. These are the type of fractured: deformity, swelling or bruising, extreme pain, wound open fracture. Third, you must speak with the victim. Fourth, it is important to inform the person that he is not allowed to move until the emergency services arrives. And lastly, support or hold the joint that surround the suspected fractured area. How to treat burn injury. First, let's define what is burn injury. A burn injury is an injury in the skin or an organic tissue primarily caused by heat or due to radiation, radioactivity, electricity, friction, or at contact with chemicals. And these are the things what you look for: red skin, swelling, blister on the skin, peeling skin, white or scorched skin. And these are the things what you need to do. Move them away from the heat, cool the burn, place under the running water for at least 10 minutes. And lastly, cover with a kitchen film lightweight. You can use plastic bag as an alternative of kitchen film. How to treat heat injury. There are two kinds of heat injury: the cramps and the heat exhaustion. Treating cramps. Cramps are painful muscle spasm, usually temporary, but can cause severe pain and immobilization. Can be made worse by heat and dehydration. What you need to do is rest the casualty in a position, gently stretch and massage the affected muscle, orally rehydrate casualty with the water or fluid and food containing electrolytes. And lastly, continuing monitor the casualty. How to treat poison. Let's define what is poison. Poison is a substance that is capable of causing the illness or death of living organism when introduced or absorbed. When to suspect poisoning. Poisoning is a sign and symptoms can mimic or other conditions such as seizure, alcohol intoxication, stroke, and insulin reactions. Signs of the symptoms of poisoning may include burn or redness around the mouth and lips, breath and smells like chemicals such as gasoline or paint thinner, vomiting, difficulty breathing, drowsiness, and confusion or the other altered mental status. What you need to do is ask them what they swallowed, how much, what time, look for clues, call emergency services or the ambulance, and lastly, reassure and monitor the level of response. How to treat snake bites. These are the symptoms of snake bites. Puncture mark at the wound, redness, swelling, bruising, bleeding or blistering around the bite, severe pain and tenderness at the site of the bite, nausea, vomiting, or diarrhea. And these are the things what you need to do. Keep the patient calm, control the bleeding, put the casualty in a position which is lower than the heart. Do not let the patient move much and talk to them, and assure the casualty. How to treat the snake bite. First, call emergency services or the ambulance. Second, place the bite lower than the heart. Third, control the bleeding. And lastly, keep the patient calm. Dog bite. Symptoms of dog bites. Swelling and redness around the wound. Painful that lasts longer than 24 hours. Drainage from the wound. Difficulty moving the affected part of the body. A warm feeling around the wound. How to treat dog bites. First, place a clean towel over the injury to stop any bleeding. Second, try to keep the injured area elevated. Third, wash the bite carefully with the soap and water. Fourth, apply sterile bandage to wound. And 5, apply antibiotic ointment to the injury every day to prevent infection. How to treat allergic reaction. The common causes of allergic reactions are food allergy, weather or environment, and various allergens. How to treat allergic reaction. First, call emergency services or the ambulance. Second, do not leave the patient. Third, if the patient has anti-allergy medicine with him, let him take it right away. Fourth, place the person in a comfortable position. And lastly, proper ventilation. How to treat anaphylactic shock. These are the symptoms. Skin reaction, including hives and itching and flash or pale skin. Low blood pressure, constriction of your airways and swollen tongue or throat, which can cause wheezing and trouble breathing. A weak and rapid pulse. Nausea, vomiting or diarrhea, dizziness or fainting. What you need to do is call ambulance, check whether the casualty is carrying an EpiPen or similar and help them to use it. Third, lie the casualty down with elevated to treat for shock. And lastly, monitor the casualty, give reassurance while waiting for the ambulance. How to treat nose bleeding. There are two most common causes of nosebleeds. These are dryness and nose picking. What you need to do is get them to sit down leaning forward, pinch the soft part of the nose, and lastly, call for the emergency services or the ambulance. How to treat hyperventilation. The symptoms of this are feeling anxious, nervous, or tense, frequent sighing or yawning, feeling that you can get enough air or need to set up to breathe, a pounding and racing heartbeat, problem with balance, lightheadedness, or vertigo, and lastly, numbness or tingling in the hand, feet, or around the mouth. The treatment of these hyperventilations are: be firm but reassuring, lead to the patient to the quiet place, explain to the patient what is happening, ask patient to hold their breath, this will reduce the respiratory rate, encourage low breathing, and lastly, breathing through their nose will help reduce the loss of carbon dioxide. How to treat choking. These are the signs and symptoms of choking: clutching at the throat, neck or throat pain, inability to speak, breathe or swallow, coughing, wheezing or other unusual breathing sound, gagging, change color of lips and face, and chest pain. These are the things what you need to do. First, cough it out, slap it out, squeeze it out, and call the ambulance or the emergency services. Keep repeating the cycle. And lastly, start the CPR if needed. How to treat dizziness. These are the causes of dizziness: pain, exhaustion, hunger, emotional stress, standing or sitting when hot. These are the things what you need to do. Lie them down, raise their legs, give them fresh air, and help them sit up slowly. If they remain unresponsive, prepare to treat someone who is unresponsive too. How to treat seizure. The causes of seizure can include abnormal level of sodium or glucose in the blood, brain tumor, drug abuse, electric shock, and epilepsy. What you need to do is do not panic, turn on their side and start timing the seizure. Stay with child, do not restrain. Place something soft under head. Do not put anything in mouth. And lastly, call 911 if seizure lasts longer than 5 minutes.